Hi there, I'm Dr. Ben Rosen, and I'm a psychiatrist at Mount Sinai Hospital in Toronto. I am also a son, husband, and father to a 1-year-old child. Since the beginning of COVID, my work has required me to come into the hospital to care for patients and support frontline colleagues in the emergency department. In the early days, I remember worrying a lot about things like, should I wear regular clothes to work or scrubs? How many times a day should I disinfect my phone and badge and keys? Should I strip down before I get into the car or enter my home? Is it safe to hold my son or hug my partner? Managing my reactions to uncertainty and frequently changing information was particularly challenging. From my training as a psychiatrist, I know that we all know how to cope, but when we are stressed or tired, we sometimes forget to apply what we know. I found these 3 strategies to be useful for my own coping and wanted to share them here in case they're useful to you. First, I tried focusing on what I can control and letting go of what I can't. I admit this was sometimes easier said than done, and I had to carefully consider whether there was something practical that I could do to change my situation. If not, I had to commit to set it aside and return to it later if needed. Second, I found that maintaining a structured routine helped make the day more predictable. I know that in the past, exercise, getting a good night's sleep, and connecting regularly with friends and family work well to keep me centered, so I did my best to maintain them as priorities. I also chose a few simple, easy-to-remember strategies that helped with stress reduction. For me, they were a deep breathing exercise and guided mindfulness meditation modules that I found online and practiced through mobile apps. Third, I found that it helped to remember that this situation is unprecedented and that it's okay to not be okay, and that experiencing symptoms of stress, whether it's feeling irritable, sad, exhausted, and demoralized, it doesn't mean you're not up to the job, it means you're human. Giving myself permission to notice and feel those feelings without judgment allowed me to be less hard on myself and seek support from friends and colleagues when needed. I learned a lot about myself over the last few months. I learned that it is possible to overcome some of the fear through exposure and practicing coping strategies. That it really helps to have people in your life who can listen, provide support, and help you feel heard and understood. And that doing your best is all you can do and is usually good enough. I hope it's helpful to hear about my experience and that you find strategies to cope that work well for you. One of the techniques that some people find helpful for stress reduction is deep breathing. This counteracts the body's natural response to stress by slowing everything down, including the heart rate, blood pressure, and pace of breathing. One technique is called 4-7-8 breathing. The steps are easy to follow. You breathe in deeply through your nose for 4 seconds, hold your breath for 7 seconds, and breathe out through your mouth for 8 seconds. Let's do one cycle together. Inhale for 4 seconds. Hold for 7 seconds. And exhale for 8 seconds. And repeat as needed.